Welcome back to my YouTube channel, The Disease Decoder. Today's our topic of discussion is malaria, a very common disease of nowadays. Let's start with the question: what is malaria? Malaria is a life-threatening disease caused by parasites of the genus Plasmodium. It is transmitted to humans through the bites of infected female Anopheles mosquito. The disease is characterized by recurrent episodes of fever, chills, and flu-like symptoms and can lead to severe complications and death if not treated properly. There are five species of Plasmodium that commonly infect humans: Plasmodium falciparum, Plasmodium vivax, Plasmodium ovale, Plasmodium malariae, and Plasmodium knowlesi. First, we start with Plasmodium falciparum. Plasmodium falciparum is the most dangerous species responsible for majority of malaria-related deaths. Causes severe malaria due to its ability to affect red blood cells of all stages. Second is Plasmodium vivax. Causes a milder form of malaria but can lead to severe disease in some cases, have a dormant liver stage. Hypnozoite. Dormant liver stage, which can cause relapses weeks to months after the initial infection because of its this characteristic. Hypnozoite. Third is Plasmodium ovale, similar to Plasmodium vivax, with a tendency to relapse due to dormant liver forms. It also contains the dormant liver form like Plasmodium vivax. Hypnozoite, less common and usually cause mild disease. I am talking about Plasmodium ovale. Next is Plasmodium malariae, causes a chronic infection that can persist for years, associated with nephrotic syndrome in some cases. Nephrotic syndrome in some cases. Our last type is Plasmodium knowlesi, a zoonotic species that primarily affect monkeys but can also affect humans, found in Southeast Asia and can cause severe malaria. Okay, mostly affect monkeys. Plasmodium malaria only affect mature RBCs. Okay. Plasmodium falciparum affects all stages of RBCs, and Plasmodium malariae affect only mature RBCs. And you need to know that Plasmodium vivax and Plasmodium ovale contain the dormant liver stage hypnozoite. Our next section is about the risk factors. First risk factor is geographic location. Living or traveling to regions where malaria is endemic, such as sub-Saharan Africa, South Asia like Pakistan, India, Bangladesh, and Southeast Asia like Thailand, Vietnam, Indonesia, like countries. Okay. Our second risk factor is lack of immunity. Individuals with little or no previous exposure to malaria, such as travelers or young children, are at the higher risk. Pregnancy is the third risk factor. Pregnant women are more susceptible to severe malaria and adverse outcomes. Immunosuppression is the second last risk factor. People with weakened immune systems, such as those with HIV infection or AIDS, are at the higher risk. Lack of preventive measures, not using insecticide treated bed nets, not taking prophylactic antimalarial medications, or not using insect repellents increases the risk of malaria. Our next section is about the pathophysiology. Malaria's pathophysiology and is complex and involves several stages like infection by mosquito bite, liver stage, blood stage, cyclic fever, and sequestration. Okay, I would like to explain all the things by a book diagram. This is the diagram here. First stage is infection by mosquito bite. Okay, mosquito bites a patient. An infected female Anopheles mosquito injects Plasmodium sporozoites into the human bloodstream during a blood meal. Here it mentioned here sporozoites enter into the bloodstream of human beings. Next stage is our liver stage. Sporozoites travel through the bloodstream to the liver where they infect liver cells. Sporozoites affect liver cells. Inside liver cells, sporozoites mature into schizons. This mentioned here is schizons, which contain thousands of merozoites like that. Thousands of merozoites. Sporozoites enter the liver cells and affect liver cells where they convert into schizons and they contain thousands of merozoites. In Plasmodium vivax and Plasmodium ovale infections, some sporozoites become dormant hepatozoites, which can reactive later, causing relapses, as I mentioned here, like they both contain the dormant form. Plasmodium ovale and Plasmodium vivax. Book is mentioning the same thing, hepatozoites caused by Plasmodium vivax and Plasmodium ovale. Our third stage is blood stage. After a few days, the schizons rupture like that. Schizons rupture, releasing merozoites into the bloodstream. Merozoites are entering into the bloodstream. Merozoites invade red blood cells where they mature into trophozoites. Trophozoites multiply and form more schizons like that. The infected RBCs eventually rupture, releasing more merozoites into the bloodstream. This cycle leads to the symptoms of malaria, particularly the pandemic fevers. This cycle repeats again and again, and Plasmodium falciparum can infect red blood cells stages, lead to high levels of parasitemia and more severe disease. As I mentioned earlier, about when I about the types of Plasmodium, uh, this is all about the disease. I would like to take the book. You can take screenshot of the book here. Um Here the mosquito bites and here are the sporozoites that enter the liver cells and they convert into the schizons. Schizons contains thousands of merozoites. Schizons rupture, merozoites release from the schizons that affect red blood cells and red blood cells convert into tropozoites. It again converted into the schizons that again release thousands of sporozoites and the cycles runs again and again. Okay, this is all about the pathophysiology of malaria. I never talked about the last step. I have completed explained every step like infection by mosquito bite, liver stage, uh, they enter into the liver cell and cause multiplication. Blood stage, they enter into the bloodstream and cyclic fever cycle repeats and again. The last step is sequestration. Sequestration is caused by on the Plasmodium falciparum. Falciparum. Plasmodium falciparum affects red blood cells adhere to the endothelial cells lining the blood vessels, particularly in the brain, lungs, and kidney. This process is called sequestration. Sequestration is the adherence of the red blood cells to the endothelial cell linings of blood vessels, particularly in the brain, lungs, and kidneys. What's the effect of sequestration? Sequestration leads to blockage in microcirculation, contributing to severe complications. Complications caused by sequestration are cerebral malaria due to sequestration of infected red blood cells in cerebral vessels, leading to impaired consciousness, seizures, and coma. Severe anemia caused by destruction of both infected and uninfected red blood cells, respiratory distress due to metabolic acidosis or non-cardiogenic pulmonary edema. And last is the last complication is organ failure. Last complication of sequestration is organ failure, leading acute kidney injury, liver dysfunction, and cardiovascular collapse. Next section is about the sign and symptoms of malaria, often with a regular pattern every 48 or 72 hours or 72 hours depending on the species. Chills and sweats is the most common sign and symptom in malarial patient. It differentiates it from typhoid fever too. Next sign and symptom is headache, then muscle pain, then fatigue, nausea and vomiting, and anemia. Why anemia? Due to destruction of RBCs. As I mentioned in the cycle, in the pathophysiology of malarial uh, parasite, it causes anemia. Jaundice. Jaundice is the yellowing of the skin and eyes, particularly in severe cases. Splenomegaly, enlargement of the spleen due to removal of infected RBCs. Respiratory symptoms such as cough and difficulty breathing, particularly in severe cases, and altered mental condition like confusion, seizures, or coma, especially in cerebral malaria that is caused by sequestration. Okay, I hope you understood. Next session is about the ways of diagnosis. We diagnose malaria by the following ways. First way of diagnosing malaria in thick and thin blood smear. It is a microscopic examination. It's a gold standard for malaria diagnosis. A thick smear increases sensitivity by concentrating the parasites, while a thin smear allows for species identification and parasitemia estimation. Okay, it is a gold standard test for estimating malaria. Next is rapid diagnostic tests. Detect species antigens produced by malarial parasites. They are useful in settings where microscopy is not available, though less sensitive than microscopy. Most commonly used test is thick and thin blood smears. Next is polymerase chain reactions. Usually for species confirmation, we use polymerase chain reactions, especially in low-level parasitemia or mixed infections. Serological tests. Note use serological tests are not useful for acute diagnosis but may indicate previous exposure to malaria. Estimate previous infection. Okay. Last but not the least is complete blood count, CBC, may reveal anemia, thrombocytopenia. Thrombocytopenia means low platelet count, or leukopenia means low white blood cell count. All are the ways for a diagnosis of malaria. Our next section is about the treatment. There are two ways of treatment: uncomplicated malaria and severe malaria. Uncomplicated malaria is treated to estimicinin based combination therapy. Estimicinin, the first line treatment for Plasmodium falciparum malaria. It combines artemisinin derivatives with another anti-malarial drug to reduce the risk of resistance. It is a first line choice for Plasmodium falciparum, antimicinin based combination therapy. Next is chloroquine. It is used for Plasmodium vivax, Plasmodium ovale, and Plasmodium malariae. Okay, in areas where the parasite is still sensitive to the drug. Next is primaquine. It is used to treat Plasmodium vivax and Plasmodium ovale to eliminate the hypnozoite stage and prevent relapse. As I mentioned here, Plasmodium vivax and Plasmodium ovale both contain the hypnozoite stage, dormant liver stage, and this drug kills that dormant stage. Okay. Uh, Treatment options for severe malaria include artesunate, intravenous artesunate. The preferred treatment for severe Plasmodium falciparum malaria. Okay, and next is quinine alternative in settings where it is not used. Means intravenous artesunate, where intravenous artesunate is not used, we used quinine. These are the treatment options for malaria. Next section is about the prevention. How we prevent malaria? We prevent malaria by avoiding mosquito bites through use of insect repellents, protective clothing, and sleeping under insecticide treated bed nets. ITN, insecticide treated bed nets. Okay. Next is vector control. Vector control environmental measures such as eliminating standing water to reduce mosquito breeding. This mosquito usually breeds in waters that are standing in pools or in ponds, like so we have to clean the environment too. Last way of prevention is vaccination. The first malarial vaccine is Mosquirix for children in high transmitted areas, particularly in Africa. Mosquirix is the first malaria vaccine used in Africa. Okay, let's summarize. Malaria is a life threatening disease caused by the parasites of genus Plasmodium due to bite of infected female Anopheles mosquito and characterized by frequent fever, chills, and flu-like symptoms. It is caused by five types of Plasmodium species: Plasmodium falciparum, the most dangerous form; Plasmodium vivax, ovale, Malaria, and Knowlesi. Plasmodium falciparum affects all stages of RBCs. Plasmodium vivax and ovale contain dormant liver stage hypnozoite, and Plasmodium malaria affects only mature RBC and can contain for years and cause nephrotic syndrome. And Plasmodium knowlesi affect mainly monkeys and rarely affect humans. Next is risk factor geographical locations like common in South Asia and Southeast Asia. Uh, Lack of immunity, pregnancy, immunosuppression, like it's most common in patients with HIV or AIDS. Lack of preventive measures. I talked about the pathophysiology in detail, like female Anopheles mosquito uh, affects the bites the human beings, and it causes release of Plasmodium sporozoite into the bloodstream that later affects our liver cells and converts into the schizones, and it releases morozoites into the blood where it affects RBCs, and the cycle repeats and again. Sequestration, I talked about the sequestration adherence of Plasmodium falciparum to the endothelial lining of brain, lungs, and kidneys that results in severe complications like cerebral malaria, severe anemia, respiratory distress, and lastly, organ failure. Signs and symptoms of malaria are fever, chills and sweats, headache, muscle pain, fatigue, nausea and vomiting, anemia due to destruction of RBCs, jaundice, yellowish of the skin, splenomegaly due to destruction of RBCs, respiratory symptoms, and altered mental status. Ways of diagnosis are: the most gold standard for diagnosis of malaria is thick and thin blood smear, rapid diagnostic tests, polymerase chain reactions, serological tests to estimate previous infections, and CBC. Treatment options: there are two treatment options: uncomplicated malaria and complicated malaria. We use three medications for uncomplicated malaria. Uh, and artemisinin is the first line drug used for the Plasmodium falciparum. We use intravenous artesunate and quinine. Then I talked about the preventive measures. Hope you like the video. If you like the video, don't forget to like, subscribe, and share with your friends for the enhancement in clinical skills. Thank you.